Today I'm going to talk about obesity regulations for Georgians. My name is Kayla Hubbard, and this is for the Community on Public Health. Obesity, adult obesity and childhood obesity are two of the biggest problems in America. When it comes to weight and nutrition, according to the CDC, more than 36.5% of all Americans are obese. This means that 1/3 of the total population has an unhealthy BMI of 30% or higher. What BMI means is body mass index, in which the person's height and weight is recorded based on their age and what they should be for a desired healthy weight. Obese-related health risks include heart disease, which is one of the #1 killers in the United States yearly. It seems to be increasing by a certain of 10 to 15% each year. Also stroke. Stroke is where there is a hemorrhage in the brain that causes brain function to get worse, or sometimes it paralyzes people and it can even enable their ability to speak or move or anything depending on which type of severity that the stroke actually has. Also type 2 diabetes. This is also a #1 leading result of obesity in America. This is because type 2 diabetes is the ability of the body to produce sugar, and this is an enzyme that actually allows the process of fat and sugars to be broken down to store as actual energy for the body. So if the person has type 2 diabetes, it literally lowers their risk of being able to naturally break down sugar, and sugar is in the form of actual sugar, natural sugar, and artificial sweeteners. A lot of the food in America actually has high glucose corn syrup, fructose corn syrup, and this is a byproduct of sugar that the body breaks down and doesn't recognize it. So the ability and capabilities of the liver and to actually break it down into useful storage is what ultimately results in fat storage on the body. Also, certain types of cancer. This cancer can be related to heart cancer, lung cancer, liver cancer, stomach cancer, different types of cancers that actually are a direct result of the products that you're inhaling, how your body processes this particular. I know that 90% of women who ultimately have a natural fat storage anyway, their ability to break down these fats has a big influence on how their organs can ultimately store fat. So these particular risks can all be prevented by eating healthy and actually promoting a good fitness level. The community impact that obesity can have is greatly increasing. Also, there is a socioeconomic relation to obesity, and in 2008 it is estimated that $147 billion was spent in medical-related issues stemming from obesity, the increased health insurance premiums, and higher taxation as well. What this basically means is that since Obamacare was enacted, that healthcare has to accept everybody, and pre-existing conditions, obesity being one of them, cannot ultimately be denied. And a lot of these premiums are continuing to increase because of this $147 billion in which the government spends in healthcare. Now, this is healthcare that can be related to either people who can afford it, people who can't afford it, and the premiums of insurance actually paying for the type of treatment that a person needs. And a lot of times with medical treatment, this can go anywhere from insulin-dependent type 2 diabetics, as I mentioned before, heart disease medications, lowering medications for high cholesterol and high blood sugar, high blood pressure, all these things that result from eating unhealthy and having a lot of fat actually be a part of their diet. Now, higher taxation is a result also of increased premiums through insurance plans. A lot of times, in order to fund these particular types of insurances, now that there is no competitive cost between each insurance company, it is important that the actual taxes are raised higher on those who are working class people in order to, afford coverage for everybody in America. Now, with this being said, the socioeconomic factors, as I had mentioned before, a lot of lower income families are greatly affected by the obesity in their communities because of their inability to afford healthier food, which is ultimately a higher percentage of cost than those that actually you can go to fast food restaurants or restaurants where you have the 2 for 2 or the 2 for 4, in which you can get multiple different products that aren't healthy for you but can feed your family of, 2 or 3 or 4. The reason it is important to stop or lower obesity is because it can increase life expectancy. It can lower weight-related diseases, as I also mentioned in the previous slides, of heart disease, type 2 diabetes, things like that. It promotes active lifestyles for growing generations and decreases government spending on obesity-related healthcare. As mentioned in the slide before, healthcare-related costs are directly related to health and their ability to ultimately fund, government programs or weight loss, fitness programs or nutritional programs for people who struggle with obesity. And if these particular obesity rates that don't continue to climb, if there's not a program that can help to lower people's, weight gain and ultimately inform them of nutritional values and things that can ultimately result in weight loss, government spending will continue to increase. Now, promoting active lifestyles for growing generations, what this means is that generations coming behind, and that's younger generations, kids anywhere from 2 years old to 25, the rate of obesity is climbing rapidly. As mentioned before, adults receive 36.5% of the overall population. And you got to consider this to be children, adults. It's astronomical. And the ability of promoting healthcare fitness programs like the one that I am going to promote, it will give children who have ultimate access to technology everywhere that they go the ability to track their miles, track their caloric intake, what exactly they're eating, whether this is getting something from a grocery store, getting something from a restaurant or fast food. They'll be able to actually know the nutritional value of what they're eating. And also, if you kind of make it a challenge where in everyday classrooms, there's an ability for these children to track their fitness levels and kind of acts as a healthy competition for, making a little bit more steps or running a little bit further, and it makes it so much less of a hassle and a task, more of it is something that's like a competitive thing. And these can, of course, trickle down to the generations after, being that these people are going to be raising children and they're going to be grandmothers and all that kind of stuff. So it's important that the generations coming in also are informed on what's going on. The public policy that's enforced is called MyFitnessPro, is the program that I'm promoting. And the 3 different requirements that I will actually talk about in this is the required nutritional labeling of food in grocery stores and restaurants across Georgia, a weight management and nutrition education in homes to promote healthy lifestyles for both adult and childhood obesity, and weight loss physical programs or trainer programs for those in lower socioeconomic communities. What this basically means is that this app is going to enable people to scan different things in grocery stores, and what this means is that it'll give it a different level. There's A, B, C, and D. The A's and B's will be labeled as green. What this means is that it's a good product that you want. It has high nutrition, it has low fat, low calories, low carbs, it has everything on the pyramid that you more or less need except for bad sugars and things that are going to turn to fat. Whenever this app actually scans these, it's going to show that these particular products are something that you want to have in your diet every day for the needed protein and the fat burning capabilities. The second is the yellow tag, which is considered the C. Now this isn't good, it's not great, but it's also not the worst. This is something that you can add to your diet that's not going to hinder your ability to lose weight necessarily, but it can kind of counteract your ability to lose weight. That's something that you kind of want to pay attention to, and you don't want a lot of yellows in your diet. Third is the red, and this is what you want to absolutely stay away from. This is going to be the ones that have high sugars, high fructose corn syrup, all the things that turn to fat. And having these abilities to scan and quickly learn without having to read each individual thing is going to give people of all ages the ability to scan really quick, shop really quick, and get what they actually need and understand what they're getting. And this can be the same for restaurants. It's going to have an ability to look at the menu in which you know exactly how many calories based on what you're getting, yet you're going to be intaking. And this goes along with fitness. Every time you walk or run or do any kind of physical activity, you can actually specify it based on your actual body and your weight and what you are right now. And it will allow you to see the kind of calories you're intaking and the kind of calories that you're burning. And these kind of counteract, well, they kind of coincide. And this app makes it a free capability of doing something like this. So that's why I'm promoting it. How and what will change? Educate without costing Americans a lot of money. It will raise awareness in all social groups. It will promote change, educate all age groups. And what it will actually, how it will change or what will be changed is this policy being implemented will require health education in the youth as more generations following are younger when obesity hits, and everyone has access to some sort of technology nowadays, and this app will be automatically installed on phones, tablets, and desktop computers. This is important because it actually enables you to access this app anywhere you are, no matter where you are. So this means that you can be in a grocery store, a restaurant, anywhere, and you can see what you're going to eat, why you're going to eat it before you actually do. And this is important because apps that are already automatically downloaded as a screen default is something that you don't have to buy, and you can have access to it at any point. This is anybody with a smartphone, anybody with a tablet, anybody with a desktop computer. This means you can access it from work, from school, or from your home environment. The cost and benefits. The cost will be an initial cost of sponsors' fees when generating funding for the program as founded by the Weight Loss Grant Program, in which a set amount is extended to obesity patients with fee consultation. This app is beneficial to the community because it promotes a free way to eat healthy in everyday life by promoting healthy choices in the supermarkets, which is also home, while also in restaurants environments by promoting nutritional education. Without this government-mandated app, a person can unknowingly be consuming more than their actual weight. So without this app, there can actually be more caloric intake or carbohydrates that you are consuming without realizing. So this will be an educational benefit to those who need it. Legislative voting. This is anybody that I'm talking to right now as far as if you're going to decide if you're voting for this policy or not, something that is implemented. It's already stated federally mandated Georgia residents have healthcare coverage that offers obesity counseling and weight loss prevention. The National Conference of State Legislation states that 16 states now include some coverage of reimbursement for dietary or nutritional screening, counseling, and/or therapy for obesity, sometimes including weight loss programs. This is going to be a push for government and non-for-profit funding in order to maintain a healthy weight loss program across the country, and therefore push for approval can be argued in the form of federal regulations for not denying access to proper obesity nutritional education and training. This is important because it's a federal mandated law that nobody can be denied based on pre-existing conditions such as obesity, and it is government mandated that obesity prevention has to be required now, whereas before it didn't. So this is something that the government would definitely fund. Non-for-profit organizations will be absolutely for, and it'll be an easy way to educate people and ultimately lower the cost of healthcare, which is kind of what we want as an initial goal. So it's very important that this actually get passed as law, because I feel that 30.5% can definitely be lowered and can help us succeed in lowering the amount of deaths and mortality rates, since we are the #1 country in the world for the amount of obesity and death rates in our country. Thank you.